Welcome back, everyone. Dr. Matilde Francois from Carle Health is joining us today. So thank you for joining us here for a couple minutes. Just continuing our Men Wear Pink series here, interview series on the 4:30. And I just want to start by asking, how often or when should women screen for breast cancer, especially if there's someone who has a risk factor?
So the average age for starting mammograms is about the age of 40. Patients who start screening earlier than the age of 40 is usually someone who's been somehow found to be at high risk, usually because they have family history or some other factors that contribute to that, or they have a young family member in their first or second degree relatives. So an aunt who got diagnosed at the age of 45, likely any first or second degree relatives related would start at age 35, 10 years younger.
And if someone gets a diagnosis, what are the next steps? What do they do? How do they seek treatment? And what treatments are available for them?
So next steps, usually it feels kind of like a whirlwind because lots of team members get involved. It's usually a combination of surgery, radiation, and medical therapy that reduces your production of estrogen, which feeds the most common type of breast cancer. So it's usually a combination of that. Sometimes chemotherapy is required.
And do you have some statistics about breast cancer in America?
Yes, breast cancer is very common. It affects 1 in 8 women. That's about 13% of the population. It only affects about 1% of men. 1% of breast cancers are those related to male breast cancers. So it's not as common in men. There's about 4 million women in the U.S. who have either are currently being treated for breast cancer or have had breast cancer in their lifetime. A common myth is that people believe that if they don't have a family history of breast cancer, then they're not at risk. But 85% of cancers diagnosed have no family history of any kind. And only about 5 to 10% of them are actually genetically predisposed.
So October is Breast Cancer Awareness Month. So what does that mean personally to you as a doctor who's in breast cancer oncology and surgery?
It means that it's bringing to light something that some people sometimes may feel doesn't affect them. Fortunately for us as people, in order to be able to live our lives, we usually live under the impression of it's not going to be me, it won't happen to me. And having awareness that breast cancer affects so many women, that it's such a common thing, gives us the opportunity to be able to reach out to women and say, no, it could be you. Go get your mammograms.
Yeah. Well, I appreciate your time, Dr. Francois, for coming in. Again, Dr. Matilde Francois from Carle Health. Do want to note as well, from a Men Wear Pink campaign, I have a couple fundraisers tonight. One is at Little Beaver Brewery in Bloomington. The other is at the Farmstead in Roanoke, and 15% of sales are going to head to the American Cancer Society. So thank you again for joining us. All the great information. We have a lot more information about this in the Men Wear Pink campaign, as well as that's online on 25newsnow.com.